Yesterday marked the deadline for Gauteng Health MEC Qedani Mahlangu to respond to the draft interim report into circumstances surrounding the deaths of 39 psychiatric patients who were moved from Life Esidimeni Centre last year. The investigation was launched by the health ombudsman, Professor Malegapuru Makgoba. To give us an update, we are joined in studio now by Steve Mabona. He's a spokesperson for the Gauteng Department of Health. Good to have you. Welcome to Morning Live.
Good morning.
All right, so the big question, there was obviously a request for an extension on the deadline. Has this deadline been met now from your side?
Yes, as the department, we can confirm that we have met the deadline. By the end of business yesterday, we had submitted the response to the ombudsman.
Yeah. The question we need to ask is, did the MEC of Health deliberately delay responding to this report, which was supposed to be released last week regarding these deaths?
No, you will have an understanding that this is quite a voluminous draft report, which necessitated the MEC to consult, to have a look at the report, just to respond to what they are saying in the report. And it was quite important for her to have more time, because we'll have an understanding that it's a very sensitive report. We're talking loss of lives. So it was important for her to have more time to have a response that will not be a harsh work, because the report is quite voluminous. And at that time, she did explain to the professor, and they were in agreement that an extension up until yesterday was actually fair, and hence we were granted that. So the intention was not to delay the report at all.
Yeah, this is seeming to be bigger than what was initially thought. We're still reporting 39 deaths. We saw reports coming out on Sunday that there could be as many as 80 deaths that happened through this decision from the health department, or the Gauteng Health Department, to close and transfer these patients from Esidimeni Centre. You've got the disabled people of South Africa describing this as worse than the Marikana massacre. This is serious allegations. How is the MEC dealing with all of this? Does she in any way take responsibility for this?
You'll have an understanding that the MEC took responsibility when we started with this process. You'll understand that after announcing the 36 deaths at that time, she then interacted with the health minister to say we need an intervention, and the minister then appointed the health ombudsman to investigate this matter. And what we did as the department was to cooperate, support the ombudsman, provide all information that was needed, availed officials that they wanted to interact with, and we cooperated. Hence, we had to respect that space. When eventualities were happening, we did not, come out in public and report on incidences that were happening, for the mere fact that we wanted to respect that space and give Professor space to investigate without polarizing the investigation. And hence we then said we are waiting for the release of the report so that we can look at what is recommended there, and we will then be in a position to can act as per the recommendations.
Yeah. Why was it in the situation leading up to this? And we understand, that Life Esidimeni, as what the MEC was saying, is it became too expensive and needed these patients to be moved. It was too much of a burden on the state. For 40 years, Life Esidimeni has been providing services to the state. And then something that should have taken years, and there were warnings from every sector, from the depression groups, from the disabled groups, to say it's the wrong thing to move them so quickly. This should be over a long time. Don't move them to these institutions. There were warnings, and yet the MEC and the department decided to go ahead with it. And in the process, so many lives have been lost. Why ignore the warnings? Why was the MEC so determined to have this happen?
Look, I think it will be premature for us to go into the report, talk about what transpired, because what necessitated the investigation was exactly that. Why the decision, why, people were moved. I think we just need to respect, probably in a week or 2 weeks, we should be in a position to can receive a report from the health ombudsman, because that was part of his investigation to look at all the aspects of what transpired, what led to the decision, who did what, did we have, capacity, and all those things. I think it will be fair for us to wait for that time when the report is released, and we will be in a position to can then engage on things that were done, things that were not supposed to be done, and all those things.
Yeah. Two questions, and I think very important questions. Firstly, will the Gauteng Department of Health officials be accountable to the families? Should the findings say that? And are they prepared? Are there provisions for the families? And secondly, is the MEC ready to be fired because of this?
Look, like as I've already indicated, us, cooperating, us interacting, with the health ombudsman, there was no any point where we resisted, because we have initiated this process. That must be actually borne in contention, that we initiated this process. So we cannot initiate a process and want to stifle its progress and want to stifle any recommendation that might have been there. As for the MEC's resignation or being fired, look, the Premier has a responsibility of appointing or firing, MECs or any executive member, and he has, indicated that he's awaiting for the report as well, so that he can be empowered on what action to be done.
Yeah,
so
okay.
We cannot really.
You can't comment on those things.
On
but
that.
You are willing to abide by whatever is in that report.
Look, we initiated the process, so we didn't have a contrary, announcement to say we will stifle the result. Or
I think what's
progress.
important now is going forward. And obviously you've had time to think about this as the department to ensure that things like this don't happen going forward. It doesn't bring back the lives that have been lost. But what has the department since put in place that this does not happen?
Look, we've been working on the ground. Our officials, they've been continuing to, take necessary precautions. They've been intervening where there's a necessary, need for that. We have been interacting with all the NGOs, conducting necessary visits, making sure that there's medication at all these NGOs, making sure that there's a supply of food where there was probably, challenges. So we've been continuing to work as normal, and where there's eventualities, intervene and assist, interact with the families on, where there's a need. So we've been continuing to work and making sure that we don't have eventualities on the ground.
Okay. Thank you for joining us here on the program, talking about this issue when it comes to Life Esidimeni Center. 39 people confirmed dead after the psychiatric patients were moved from the center, but there are reports that as many as 80 may have died. But that will be discovered after this report is released. But the interview really focusing on the fact that the MEC, Qedani Mahlangu, has now responded to that deadline and has put through her report. So there we go. Steve Mabona, spokesperson for the Gauteng Health Department, thanks for joining us.
Thank you very much.
All right, let's take a break here on the program. We'll have the news at 7 for you. And remember, in the next hour, there is a TNA. Stay tuned.